What a day. Good morning and thank you for joining us here today. As Erie County, our partners, turn the page on the past and start a new chapter of how healthcare is delivered in our community. Today is a great day, and it's a day I envisioned more than 2 years ago. Because with the opening of the new Erie County Health Mall, we will truly make a difference in the lives of the people in our greater community. Because today we guarantee a better future, a healthier future for all of our residents. A future where no one is left behind, regardless where you live, what your income is, no matter where in this community. You will have good, high-quality, affordable health care. Today is the day we stand united as one community to change the way healthcare is delivered in Western New York. Today is a day in which we do not just rededicate and open the doors to a new facility, but, like a phoenix, rising from the ashes of the bad decisions of the past, we commence a new, better model for healthcare delivery, not just for our community, but for the whole nation. So when I say today is a great day, I truly mean it. And I do not know if I am more prouder of an accomplishment that I've had in my tenure as county executive as this one here, and truthfully that includes dealings with a certain football team. But before I go any further, there are a number of people I have to thank and note their appearance here today on behalf of the people of this community. We have a number of elected officials here with us. First off, from the New York State Assembly, Assemblywoman of this district, and I believe also a legislator from this area as well earlier, Assemblywoman Crystal People-Stokes. From the Erie County Legislature, we have with us here today the former chairwoman of the legislature and current minority leader, Betty Jean Grant. We have the former chairwoman and the legislator for this district, Barbara Miller-Williams. From the Erie County Legislature as well, we have Lynn Dixon. Thank you for being here, Lynn. Former legislator for this district, Tim Hoax. Thank you for being here, Tim. And also we have a representative from Councilmember David Franchek's office, Anella Bai. So Anella, thank you for being here on behalf of the Now there's quite a number of people that I need to thank and for all that they've done in making this day happen on behalf of the rest of Erie County's team. The Department of Public Works was instrumental. We own this building, and they've done a tremendous work to get this building to the place it is. So on behalf of Erie County, I want to thank the Public Works Commissioner, John Lafredo. John, thank you. Senior Project Manager, Jeff Sack. Project Manager, Jim Hearn. Inspector John Good. And the Deputy Commissioner for Buildings and Grounds, Dan Rizzo. Thank you all for your work. From the Erie County Department of Information and Support Services, Commissioner Michael Breeden and the Director of Information Technology, Lori Stillwell. Thank you very much. From the Erie County Attorney's Office, Assistant County Attorney Kristen Wilder, who made sure all the I's were dotted and T's crossed correctly. Thank you, Kristen. From Cadeni Architects, Regina Lachese and all the partners, but especially Joe Lenahan and Tim Kopinski for their hard work. The members of the Erie County Legislature, who were strong advocates for this project, especially former chairwoman and minority leader currently Betty Jean Grant, and former legislator Tim Hoax, who previously represented this neighborhood. Both were very vocal and determined to get this through the legislature through 2012 and 13, and I thank them especially for all the work that they did to get this through the legislature. And two people certainly, last but not least, my health commissioner, Dr. Gail Burstein, who realized from the start when we sat down and talked about reopening this facility that we needed to have a new path, a new way for the future, that we could not use the old methods and the old models. And she said, we can do this, but we've got to do it a different way than the past. The goal of restoring high-quality health care to this facility is realized, and she was right. Thank you very much, Dr. And someone who's floating, there he is. We affectionately call him the Deputy Commissioner of Health. It's because we don't actually have a title in the county budget called Deputy Commissioner anymore. But he is the Special Assistant to Commissioner Bursky. Ben Swanenkamp.
Yeah.
Ben spent countless hours over the last 2 years shepherding this project through from an idea to successful completion. There were times he walked into my office saying, oh my God, what are we going to do? But he got it done. And if anybody can recall the head project manager of assuring that we got this project done, it's Ben Swanenkamp. Thank you, Ben, for all that you've done. Now, did I mention that today's a great day? It is. Because today's the day we gather together, finally, to right the wrongs of the past. We gather to reaffirm our commitment to working together to make our community healthier and stronger. And we gather to show that in Erie County, we get things done in new ways by bringing people together, bridging differences, and drawing on the strength of the community to make it happen. It was a dark day when the former Gajewski clinic located here at 1500 Broadway was shuttered. While the clinic was older than many of the bright, gleaming healthcare facilities you may find elsewhere, it was a community asset. A place where residents knew they could go to address their health issues without going to an emergency room. The care provided here was an invaluable community resource, a way to keep the community healthier and to empower people to take charge of their own health. Unfortunately, that all changed when in 2009, this clinic was closed by the prior administration in a misguided attempt to save money. Too often decisions are made in government based on the dollars and cents associated with a project or a program. But often the true costs are not measured on a balance sheet, but on the impact the decision has on our bosses, the people of the greater community. Now, I decried the closing of this health clinic, noting that it would inevitably drive up emergency room visits and the high costs they entail, in addition to depriving an entire community of high-quality, affordable health care. And while as controller, there wasn't much that I could do. I promised that if elected as county executive, I would right this wrong. And there was very much that was wrong with closing the clinic, and nothing that was right about it. Costs did not go down. Instead, they went up, as shown by my reports as controller, as well as reports by my Medicaid Inspector General, Michael Zucala. More residents were forced to resort to very expensive emergency cares for just basic illnesses or toothaches, which could have been more cost-effectively handled here. Routine prenatal care, taken for granted in every other community, was suddenly no longer available to anybody who lived in this zip code, 14212. Gone were also the preventive and proactive and affirming health programs that have served this community well for many years and formed the basis for healthy communities across our entire nation. They were not replaced, just discontinued, cut out of the budget. In some people's views, no longer having an involvement in Erie County with this clinic meant that the issues would just go away. But health issues don't go away, as much as we hope they would. They fester and they get worse when nothing is done. You can't ignore diabetes, high blood pressure, or another disease and hope they will go away. You do not. You can't ignore a toothache, cracked tooth, or gum disease and think they will disappear on their own. They will not. You can't ignore a pregnancy and the need for prenatal care, otherwise you're putting both the mother and the future child at risk. You can't ignore the fact that many people are in need of mental health counseling and other services today than there were in the past. Like every other community in Erie County, New York State, for that matter across the nation, there is a very real need for healthcare services in all communities, especially this community. Ignoring that reality is foolish, dangerous, and as we've seen, costly too. As a community, we are better than that. We expect more and our residents deserve more. As I've said before, governing a community as diverse as ours is not just about balancing a budget and the dollars and cents that are contained therein, but proposing common sense solutions to fix the ills of the greater community. I promised as a candidate for county executive that if I was elected, I would find a way to reopen this clinic. I've kept that promise, not on my own, but by working together with others to create a better future for all our citizens. Erie County invested nearly $3 million on this project, a true investment for the health and well-being of all of our citizens. But we could not do this alone. Collaboration is the key to the success and the linchpin in making the Erie County Health Mall work. No one entity can do it alone, but working as a team, we can, have, and will succeed. This first-of-its-kind partnership brings together committed healthcare partners under one roof to provide a continuum of services to the patients that will be seen here. I specifically want to thank, of course, Catholic Health and its St. Vincent's Health Center, UB Dental and its First Care Dental Clinic, Lakeshore Behavioral Health, and Mid-Erie Counseling and Treatment Services, our partners in this endeavor, for their vision and dedication to improving this community's health by joining us in this important venture. The old healthcare model does not apply here. This is not an Erie County clinic run by county employees. Rather, Erie County provides the building, security, and maintenance so that our partners can succeed in doing what they do best, providing the services to their patients. Erie County's the landlord. I've been told by all the tenants they're going to pay their rent in time. It's good. Most of the tenants. There was a little uncertain in that. Now, this new model is also in alignment with the Affordable Care Act. It allows all the partners, as I said, to do what they do best, focus on providing the services that they do best. It's an exciting new model and that one we think will gain attention as the new way to provide these services, not just here in Western New York, but across the country. And when you tour the inside of this building, you will know this is not the same old health clinic as before. It's a state-of-the-art health home for the entire community, built to LEED Silver standards and comparable to any new healthcare facility in Western New York, including the new shiny ones that often dot the suburbs. I've had many achievements as my tenure as your county executive, but if the opening of the Erie County Health Mall was my sole accomplishment, I would still feel that my time in office had been a success. This is really that important, folks. Today is a celebration of our ability to work together to improve health, and a reaffirmation by the people of Erie County and this community. We care about each other, and we will work together to create a better future for all. We have shown we can work together and work hard to improve the common good. Let us never turn away from our common purpose and our common goal of providing high-quality, affordable health care for the entire community. In conclusion, let me once say to all our partners involved and everybody who played a role in making this happen, thank you. We would not be here today without all of your strong support and lots of time and effort. And to the people of Erie County, let me be the first one to say, welcome to your new Erie County Health Mall. Thank you, everyone.